Welcome everyone to Turning Point's third Safer Lives conference. I can't believe we were at our third. And I'm so pleased to see so many people here today who all want to talk about reducing avoidable overdose deaths.
I'm going to use my presentation today to look back a little bit to the origins of harm reduction, to where it came from and why it was so important, and to use the opportunity to talk about Turning Point as we turn 60, as Deb said, and to look back through our own archive around some of the innovative work that we've been involved in.
This is the drug-related death rates across the 4 nations of the UK. So Scotland has the highest drug-related death rate in Europe, which has more than doubled over the last decade. We've also seen big increases in England, Wales and Northern Ireland. And this is a public health crisis. In some parts of the country, this is a public health emergency where services are being overwhelmed.
Great to be in a room of harm reductionists. And I hope that I can offer a tool which we can have in our toolbox.
We're going to be looking at promoting harm reduction via social media, right? Click.
You're talking about people that have direct experience of living with a drug problem, so people who are currently living it now really is what we're seeing.
A big priority was making sure we had lots of medical appointments available so that basically anyone that needed to get on a script, be restarted on their script, we could get that sorted straight away. So it really brought home, I suppose, that importance of harm reduction all the way, but also being on a script.
Why a peer supply? So I would argue that peers have privileged access, increased reach and instant credibility within the communities of the people most at risk of drug-related harm and ultimately drug-related death. I would also suggest that we have the most skin in the game. I've been burying my mates for a couple of decades now. Some of the peers that have been involved in some of the projects, that's much, much longer. And tragically, even more recently, it's their friends and their kind of family that are passing away. So that's why a peer supply.
If we're talking in this, making every contact count type of context, we've got stuff like Hep C prevention, reducing respiratory risk, and whatever else people may need assistance with if you're coming into services.
We're looking at there being equity in terms of people who are using any drug being able to come forward and have their drugs checked. And you have to buy a very expensive ticket to get into a festival. There will be many people that we don't reach if we only provide services in those environments.
Because of this change in drug market, it has never been more important that we teach young people how to respond to overdose.
We have record levels of overdose. We've talked about it a lot today, but I would like you to take 1 minute as you leave the room today to reflect and look at those flowers at the back of the room that have been made by the brilliant members of our Anyone's Child campaign. Each one of those represents a life.
Keeping people safe shouldn't be controversial, right? Simple as that.
What we do really need is legislative change, because we want to avoid a postcode lottery. It shouldn't really matter where you live, you should be able to access these type of services.
And I think as we collaborate today and talk to each other on our tables, I guess a question we could all ask is, what's my role in this? What's my role in helping to save more lives? Thank you.